Wait a minute, Chris.
Good evening, everyone. Welcome to the COVID update. At this time, I would like to turn it over to Dr. Berkowitz.
Thank you, Ms. Levin, as well. Good evening.
Evening.
Some of this will be very familiar to you. It's presented in the same format it has been in the past. We have made a few changes to the format. Hopefully they will bring greater clarity to some of the information. And I hope that from this point forward, we'll be in the exact same format moving forward. Again, certainly want to make this information clear and transparent. People be able to easily follow it, understand it. I think we're there. We may need to tweak it a little bit more, but hopefully not. First one you're very accustomed to seeing, our incidence rate, comparing us to the community as a whole and comparing us to the state. And if you look at the attack rate, you'll see that we are now at 0.6 of the county and 0.82 of the state. 1 to 1 would be equal. As you all know, for the weeks coming out of Christmas, the last week of Christmas, the 2 weeks coming out, we had to asterisk our data there because we were catching up the entry of data from the Christmas holidays. Now, that did not prevent anyone from getting the correct information that you need to stay at home. But particularly the student information, it took about the entire first week we were back for the 3 nurses that entered that to enter all of it so that we could chart it. And we also believe, and there wouldn't have been any reason to expect they did so, that people didn't necessarily report to us the week of Christmas or as much so the following week, but they reported to us before they had to come back to work. Anyway, I believe that's leveled out. I think you probably likely could have taken an average over those 3 weeks, but we are caught up with those numbers, and what you see there reflects the week ending 1/20/21. All right, the graphs look a little bit different. This is the employee isolation. As you look at it, you'll see in order from top to bottom, elementary school, high school, middle school, and other. Now, this includes people working at a school. So they're listed in elementary if they're an aide. If they're a fans employee working at that school, they're shown here. We'll show teachers in just a minute. All right, so as you can see, the peaks and valleys, and you see what they follow, and they follow that same trend of after a holiday, in some cases after a weekend. The reason elementary is larger because proportionally there are far more elementary teachers than there are others. And then we provided that information to you in the top right corner. There are nearly 4,800 elementary teachers. There are only 1,800 middle school teachers and 2,200 high school, and then 2,100 other employees. So this is isolation data. And you see the peak number up there is just under 20. All right, here's the isolation data graphed differently, graphed by level. Just a different representation. It follows that same graph up and down, and the order here is elementary at the bottom, middle school, second bar, high school, third bar, and other, the fourth bar. Reading from the bottom to the top. Green, blue, yellow. I think that's black. Employee quarantine data by level. They're similar graph to the first one you saw. And it shows the peaks and the valleys. It also gives you the number of employees, so you can draw conclusions based on the overall number. Same data there represented in a bar graph. Employee quarantine data. Remember, in quarantine, those who have potential exposure, out of school and at school. And you see that huge increase the first week we're back coming from out of school. You'll see valleys and peaks there as well. New quarantines by exposure location, same information, bar graph instead of a line graph. Some people find that easier to follow, less confusing. Now, employee data by position type. Green, the bar at the bottom, they work directly in contact with students. That could be a bus driver, that could be a food service worker, that could be a speech therapist, that could be a classroom teacher or an aide. The blue, the bar at the top, those that do not work directly in contact with students. They may come into contact with them some, they don't work in direct contact with them. Quarantine data the same way. Those in direct contact with students and those who are not in direct contact with students. Student isolation data by level. This is the student isolations. High school at the top. We have about 21, close to 22,000 high school students, followed by elementary school. We have 34,000 elementary school students. In middle school, we have 17,000, right at 17,900 middle school students. And you'll see there isolation peaks and valleys. And almost every one of these peaks and valleys follows that same pattern. So isolation data represented as a bar graph. Quarantine data represented the same way by a line graph, the bar graph, followed by a bar graph. And you see peaks and valleys, and some of these are less sharp than they were in the first one. There it is represented in a bar graph. This is quarantine data by exposure location. Out of school, at school, and extracurricular. So out of school is the top line. At school is the second line, blue in your graphic, and extracurricular is the bottom line. Now that's quarantine data by exposure location. And there's quarantine data represented in a bar graph by exposure location. What are the other South Carolina districts doing? You're accustomed to seeing this. 25 districts are full face-to-face, up from 21 2 weeks ago. 12 are fully remote, down from 28 2 weeks ago. 42, including GCS, are operating under some form of hybrid schedule, up from 30 2 weeks ago. Of the 12 largest districts in the state, which represent 51% of the state's student population, 3 are on a full face-to-face schedule, enrolling 28% of the students of that 51%. 28%. 1 is fully remote, enrolling 6% of the students, and 8 are on a hybrid schedule, including GCS, representing 66% of the 51% of the students' population. And that's from the state's website as of yesterday afternoon. Upstate districts, full face-to-face, Oconee, Anderson 1, 2, 3, 4, and 5, Spartanburg 1 through 7, Lawrence 56, Greenwood 52, and Abbeville. Full remote, Lawrence 55, hybrid schedule, Greenville, Pickens, Greenwood 50, and 51. This came out just recently, MUSC study. They looked at the 38,000 Charleston County School District in-person students and staff for the period September 8th to December the 18th. Only been a handful of cases that may have been transmitted within the schools and within the classroom. Majority of cases have been acquired outside the classroom. The ones that did happen inside the classroom most often involved a teacher giving it to a teacher or a teacher giving it to a student. They do not have any examples of students giving it to teachers. To the best of their ability to track this, and it was tracked by a person at MUSC, an infectious disease pediatrician. These are the protocols in place for Charleston County to give you the context for their findings. They have a social distancing of 6 feet in their classrooms or 3 feet with appropriate plexiglass dividers. Students and staff are expected to wear face coverings at all times. Exceptions to masking include meal times, outdoor activities where 6-foot distancing can be maintained, planned mask breaks, and individuals working in private spaces. They have minimized student transitions and they enhanced sanitation and hygiene practices. And with the exception of some deviation with the masking and what we do, that is almost identical to the protocols that we follow and have in place. Quarantine period update. We went to the 7-day quarantine period with a negative test. Out of 145 employees affected during the period 11 January to 25 January, 75 employees returned to work prior to day 11, following testing and reporting protocols. 40 employees returned to work on day 11. They either did not get tested or did not receive positive tests or did not receive test results prior to day 10. 30 employees tested positive before the end of the quarantine period. In-person learning update. High schools at the 75% attendance plan schedule. We've had no major issues. We have some concerns regarding plexiglass partitions causing the muffling of sound. In addition to responding to any reported concerns from classrooms, we're taking readings and a random sampling of classrooms to establish baseline decibel readings. The optimal decibel reading level in a classroom is 65. We're evaluating potential technological solutions to that. And you see there the process to remedy issues that might arise that we don't discover through random testing. Testing update. Nothing to do with COVID testing or testing for the ability to hear well in the classroom. SC Ready and SC Pass are required by the state for state and federal accountability purposes. They cannot be administered at home. If those requirements are not waived, the advocacy committee had some discussion of this a little bit earlier. We will need to schedule e-learning days in May so the virtual program students can come into the buildings for testing without exceeding our capacity both to seat them and to proctor the test. The number of virtual teachers is not sufficient to proctor the test, just them working by themselves. Makeup testing days will also have to be added to the calendar for those students, as well as for the brick and mortar students. The only need for the e-learning days would be the days they all come in, not the makeup days. So that will be some 3 or 4 days. We're working on that schedule right now. Hopefully this testing waiver will be granted by the federal government, and hopefully the state will not require additional testing. We already have a very accurate gauge on the things that our students need assistance and remediation with. More testing simply takes more time away from classroom instruction and further compounds that problem. So we are certainly not in favor of doing this testing that will have very limited instructional value, if any instructional value. We've got all kind of assessment of where our students stand, particularly in the core areas. Vaccine update. Wish that we had more information to present to you here, or more positive information to present to you. But we're continuing to work with the public and private vaccine providers with the goal of enabling those employees who wish to be vaccinated to do so as soon as possible in as organized a manner as possible, preferably at a dedicated site or sites. We have not made great progress in that goal, although we have reached out to those providers available to us. To give some context, I know you have heard that educators are included in the SC vaccination phase 1B, along with firefighters, law enforcement, and corrections officers, the U.S. Postal Service, grocery store, and public transit employees. And also added to that group have been employees and workers in the manufacturing, food, and agricultural industries. We are still in our state currently in phase 1. Within 1B, there is no current sub-prioritization. There is no one group in there that has, if you were to look at that as they're listed, for example, they're not in an order of priority. There is no order of priority. They're simply listed there. And again, we're currently in phase 1A. I do not include it in here because we have planned for the committee of the whole in February a more extensive report on our remediation efforts, both those currently underway, those planned for the summer, and some preview of those that we would employ in the fall of the year. So information regarding second quarter grades and remediation efforts will take place when we brief the board at the committee of the whole at the February CAL. Certainly take any questions that you all might have.
Bert, would there be a state report card since we didn't have the standardized testing this past year?
There will be a state report card, but it will, I believe, again, for this year, not include a grading of the school. So there will be a report card.
So what will it include if it's?
Just narrative information, because there isn't comparative data on which to base it at this point. The only thing I know that they might possibly do, and I'll defer to Dr. Turner since he has a seat on the EOC, I suppose if they were to do testing this year, they might try to go back and compare it to 2 years ago. That is not a valid comparison. Dr. Turner, do you have any insight on that? I didn't mean to catch you with your mouth full.
Sorry. The EOC did vote to not have ratings for next year on a report card, but they did vote to have the assessments. Yes, ma'am.
Mhm.
Excuse me?
Didn't the standardized testing the assessment?
Yes.
So how could? Okay, I'm confused. Say they did vote to have the
They voted to make a recommendation to have the assessments at the end of the year, but not to have ratings on a report card using those assessments.
But I guess to clarify, that's not the EOC's decision.
No, that was
a
their recommendation.
from the EOC to the
Legislation.
legislature.
I still got the EOC. No, I'm just kidding. Can we go back to the last slide? Because I had a question, but okay, you said something about subs not being a part of that. Aren't they considered educators? Did you say something about subs?
No, ma'am,
not being-
I don't think I did. If I
Oh,
did, I
okay.
didn't mean to.
I thought I heard you say.
No,
that.
in fact, we polled our employees Monday to request of the state, and we included, because we had to do them a little bit differently, we included our substitutes in that polling of employees as to how many would be, were certain they wanted to take the vaccine, were unsure, sure they wanted to do it, not certain, or certain they didn't want to. What were the three choices, Terry?
Yes, I want to receive the vaccine as soon as possible. No, I will not take the vaccine this time. I'm undecided. And then we also had one about, I've already received one of my COVID vaccines are already completely correct.
So do they have a deadline for the 1A so that we can get to the 1B?
The last conversation that we had about the possible timing of 1A was February, March. I'm sorry, 1B. Yeah, finishing 1A and moving to 1B. Sorry, I was not clear on that.
Oh, within a month. Because I have a lot of people that are asking me, educators, that are asking me,
From-
can they get vaccinated? And so they don't have exact timeline as to when they're gonna stop with 1A to start phase 1B?
No, ma'am, they don't. And I would be at least based on our early conversations, but our most recent conversations about this, I would be leaning more towards March than February. I think you all have seen the reports about perhaps there not being enough vaccine to complete we'll make sure I say it right, 1A. So that's concerning, obviously.
Thank you, Ms.
Now, I
Goodwin.
think there were some decisions made over the last several days to ramp up production of vaccines. It would still appear, just based on some accounts that I read, that for whatever reason, it would seem South Carolina has received less vaccine than other states, even when controlling for the difference in population. I do not know whether that's accurate or not.
Thank you, Ms. Goodwin. Call on Ms. Mosley.
Thank you. I thought I read, and I may be wrong, and since I don't have any insight into DHEC, I thought I read that 1A was supposed to end on January 15th. And then after that, if you were in 1A and you didn't let them know by January 15th, that you kind of had to go to the back of the line. Is that some date? That date sticks in my head.
I believe that was, you were supposed to have signed up by January 15th, I think.
Okay.
And then if you fail to do so, you'd go to the back of the line.
Okay.
I don't know if they've since changed that or not, but I recall seeing the same thing that you're talking about.
I guess my question is, they cut off the sign up for 1A?
I would hesitate to give you an answer to that, but I will certainly try to get the answer to that.
Just curious.
You're still signing up?
1A? Okay.
Yeah, in our conversations, at least at this point, though, we are seeking other sources where we might obtain the vaccine. Our primary source, because they're the regional provider, is Prisma. So that February-March information came from Prisma in our most recent discussion with them about vaccinations.
Okay, DHEC had a briefing today, and I tried to listen to some of it about this rollout, but it was very difficult to discern what their plan was. So anyway.
I think somebody's trying to update me on that right this minute, and I believe that update is 1A's been extended into February, and 1B, the reference was early spring. Now, that's coming from somebody I think who may have listened to that briefing that you're talking about.
Okay. That's disappointing.
It certainly is to us as well.
Okay, so I have a couple of questions. So the WHO came out and said that miraculously, with some stuff we already knew, that the PCR test is no longer, or I should say is not reliable, in that it renders too many false positives because the amplification cycle it's too high. So has DHEC adjusted our protocols, our testing? I haven't seen anything about this in the news. I've actually asked some news media to investigate, because I'm curious to know how long it's going to take for them to adjust those guidelines so that.
We're seeking the answer to the information you just received. As I read that, and again, a lay person reading it, that's why we want to get information from one of the infectious disease or epidemiologists that we deal with. As I read it, what the WHO was referencing was, as the virus decreased in frequency, you should adjust the PCR threshold downward where you do not receive positives at as high a level. Now, that was a layperson reading it, so we have asked that one of the infectious disease or epidemiologists that we deal with interpret that for us. But whatever the answer to that might be, we certainly you know,
I would like an answer to that because I've been reading about this problem since last summer, that different medical opinions on the PCR test, and now what doctors on the outside have been saying is wrong is now being published as wrong by the ones who are steering our policy. So it's just interesting to me how the narrative continues to change. Just curious about that. So when you put up the quarantine numbers for the employees, bar graph, and you indicated on one of the slides that I think 70 something came back before, sorry.
Oh, that was the return,
and that 30 tested positive before the quarantine period end. Is that correct?
See if I can, here we go. I believe that's the slide you're referencing. Yes.
Yeah. Okay. Do we know, were those 30 symptomatic, or do we know any of them symptomatic, or they just got tested and they came back positive?
I do not have that information, but the protocol is if you test and you come back positive, you can't early end your quarantine.
No, I'm just curious because it would kind of support what the WHO has now come out and said. So again, I'm a critical thinker and I like to connect dots, and I'm just trying to figure out if any of our data supports some of the things that we're seeing changing coming out, because to me, that would be important information to know.
I would agree with you. I just don't think we can make those assumptions at this point.
I was just curious if we knew whether or not they were, because that's the quarantine data is something I've wanted to track all along. And I think you guys told me you can't track it because when someone is quarantining and then they test positive, you change it in the system. And so there's no way to know at what point they change. Okay. But it looks like based on that the majority of the employees are able to return to work prior to day 11 because it looks like the majority they're in quarantine. If I'm just using some deductive reasoning skills, they're not testing positive in that quarantine period. So,
yes. Mm-hmm.
All right. So going on to back to the study, I saw that article that Charleston County put out, or the MUSC physicians put out. Have there been any other study? Is Charleston County a hybrid? Or I couldn't remember if they were one of the 3 schools that were face-to-face.
Charleston County is face-to-face, almost identical to what we are, except as I understand it, at the high school level, they let all students come to school every day. But if they will not fit in their classroom, I'm not sure exactly how they manage this, but if they will not fit in their classroom in whatever configurations they have, they are sent to a commons area within the building and supervised by an employee. They basically are working virtually the same as they would be if they were at home. So they're all there, but sort of with that caveat. So like we're 100% elementary in person, 100% middle school in person. We're not quite, we're at 75% high school in person. They technically are 100%, but that's sort of the footnote to the 100%.
Okay. So speaking of the high school, I've received lots of complaints about the plexiglass. I'm glad you addressed it in this presentation. However, the couple of things you didn't address, sounds like noise is the biggest complaint. I mean, being able to hear is the biggest complaint. I'm also getting a lot of, my student can't see, there's the film, when they sanitize the classrooms after hours, there's a film left on the plexiglass in many cases. And so I'm told that depending on where you're sitting, and of course you've got some students sitting with their back to the instructor. I'm getting so many complaints from people that I'm trying to understand what we're accomplishing by sending children back into learning environments that, in my opinion, don't sound very conducive to learning. And I'm just trying to understand that because I've got students who've been told they can't turn around. I've been told that there are teachers that are so married to the 15-minute rule that it's like, if you turn around, you have to turn back around in 15 minutes. I mean, I don't really fully understand it because I haven't seen the layouts of these classrooms, or haven't seen this actually happening in full time. I just promised a few people I would ask the question.
Yeah, and we need to know where those places are. Because, for example, if you went in a room
think every classroom's a little different.
They are a little bit different based on the layout, but I was trying to think, it was probably before you were on the board. We had a room set up in here. Then we set one up out at Space Drive. Is the one still set up at Space Drive? Certainly, if you want to go out there and look at that one, feel free to fill.
Well, I'm actually
Yeah,
I'm going to have a tour Thursday after school.
In a classroom, the way those pods are set, there's supposed to be 6 feet between the pods. So you should reasonably be able to turn around, take your mask off, because you got 6 feet. Now, if they don't understand that, we need to make sure that they understand that. While they're sitting there within that 3 feet, they're supposed to keep them up. That was really borne out. You know, DHEC has said that, and CDC has said that. When we first looked at the plexiglass configurations, we actually brought the certified industrial hygienist that we use on contract for the district, indoor air quality issues like that. We had him come over and he ran some demonstrations for us with the plexiglass by taking an aerosol, spraying it on the plexiglass, using whatever substance he used, somewhat, I guess would be equivalent to if you were to sneeze. So that was the diameter, the consistency of what he sprayed on the plexiglass. So from the distance that you would be sitting from it, he sprayed that. Hits the plexiglass, doesn't go anywhere. That's what it's supposed to do, doesn't go anywhere. When you do that, there is some amount that goes up. And that amount that goes up can go over the plexiglass. So I think that reinforced to us why they have said to us, you still need to be masked inside the 3 feet to eliminate that drift that could occur. So that's the reason for it, but they should be given breaks. Their lunchtime, many of them have their lunches configured where they're set up. They can take the mask off for however long they're in there. It doesn't have to be just 15 minutes. There are a lot of different things they can do. Sometimes it's perhaps a lack of awareness of what they can do. And maybe for some people, they've maybe not been willing to do that. So they may need some extra guidance about that kind of thing. I did notice in one of the classes where I sat down the other day that there was that film you're talking about. So we talked with Philip about what protocols do we need to have in place. For example, you saw the one about being able to hear. So we've got a process where you go in and assess that and what can we do to fix that. We found over time that some of those pods drifted to where they weren't as far apart as they were supposed to be. And we got some complaints about that, some concerns about it. So every plant engineer now has on their checklist going to a certain number of rooms every day to make sure they're still set up the way they're supposed to be. So anytime we identify an issue, a problem, or a concern, then we try to put some sort of process or procedure in place to correct that. Now, I have to say, in those classes I went in, I didn't have any trouble hearing. And my hearing is probably not as good as most of the 16 or 17-year-olds. But that doesn't mean there's not some room where somebody maybe doesn't talk very loud, or maybe a student doesn't hear very well, but there's not a problem. We need to find those and correct those.
The consistent complaint across the
That's
district.
why we need to know where it is, who it is, and what rooms they're in. For example, I went in a classroom at Riverside. The teacher had asked me to speak to the class, which I did. The first question that I was asked came from a student that was the furthest seat away from where I was standing. He had a mask on. He was sitting behind that plexiglass. I didn't have any trouble understanding him. He didn't have any trouble understanding me, but now I talk fairly loud, particularly always did when I was teaching. They didn't have any trouble hearing me in the back of the room. But that's anecdotal. Other people maybe don't talk that loud. They might have to
Have a mask on?
a little louder. Did I have a mask on?
And the reason I'm asking is because the teachers are masked and they're talking and they're having the sound having to carry.
I did not when I was talking to him because I was standing 6 feet away from the students in the room. But I can assure you, if I'd had a mask on, he'd still heard me. That wouldn't have been a good test on it. And there's a place in every room teachers can stand and speak without the mask. They do not have to wear a mask. The mask is if they get inside that 6 feet, so we don't have to worry about them being quarantined.
I appreciate that. I'm not sure that's happening. But since I'm not in the classroom, I can't guarantee it. So what my message should be to folks that report to me is to report to you which school, which classroom.
So we need to hear from those folks that are saying we have this problem. We know what school, what classroom. Just have the parent contact us, have the student contact us.
Okay.
They'll go see the principal. We would expect the principal to take care of it. They have to know there's a problem though.
Classing multiple more kindergarten classrooms. So now students who have not been masked all day are going to be in mask.
The only place
Young
we
age.
give plexiglass to kindergarten classroom is if we have a request from a principal or a teacher to do so. Philip, do you know how many of those there are?
Yes, sir. There were 12 that requested elementary.
So why are they requesting these?
I'll defer to
Feel
Philip.
safe? I mean,
Why were they requesting?
I would say a couple of reasons. There was a situation where for social distancing, they had the kindergarten class, one class split up into 2 rooms. So you had the teacher in one room, the assistant in the other, and the teacher was having to go back and forth. Principals, teachers, some parents didn't feel like that was the most conducive way to conduct the class. So those principals requested that we set up pods in one room so that the class could be together in one room with the protocols using plexiglass. Some principals wanted to bring back some students that were on the waiting list, and the only way they could do that was to set up some spaces to make that happen. So we've had, there were 12 principals that made that request.
These are virtual students that we told had to stay virtual unless we had space in the classroom. And now we're making space in the classroom by masking up the kids that were already brick and mortar.
Well,
I'm trying to follow this here.
right. I would think there's still a big waiting list there. Now that didn't solve that problem, but if a principal could bring those classes back together and also have room to bring a few kids back off the waiting list, they did that in unison with that.
Okay.
That wasn't their primary goal, but if they had room in addition, they allowed some additional students
So
to come
again,
back and join.
so I'm clear, we're masking up kindergartners now so we can bring more kids in the classroom.
Well, the original goal was to bring kids that were already there together under one classroom so the teacher could be with them. And then once they did that, if they had a couple of seats still in that classroom and kids on the waiting list, or maybe a new kid moved into the area, they were able to accommodate that student. That wasn't their original goal. It was a byproduct of bringing those kids back together.
Okay, so Dr. Royster, I'm going to ask this question. Has DHEC or have you, I know you sent us a list of medical professionals. I don't remember seeing a mental health professional on this. I don't remember seeing developmental specialist on this list. So I'm just trying to understand, have we evaluated our classroom setups to really have an opinion of whether they're developmentally appropriate because I'm just feeling, I'm getting a lot of pushback from parents. I'm getting a lot of questions, and what little I know from my mom, who is a child development, in my opinion, guru, I just feel like I don't know. I'm really questioning what we're doing to kids right now. I feel like the numbers do not support what we're doing. I feel like DHEC has demonstrated their inability to manage, frankly, anything. And I just have a grave problem with constantly taking direction from this organization that does not possess information. I understand they possess public health knowledge, but they don't possess, I just feel like we're doing more harm than good. I feel like the cure has exceeded or has become worse than the disease.
Certainly
And I'm hearing that from so many parent concerns, but everybody's so weary of this right now, 10 months in. And I'll be honest, to hear the disappointing news of the vaccine being pushed out even further, that's exhausting to hear today.
I think it's probably exhausting for everybody that's involved in it to hear that. And I certainly understand your perspective. There are child development experts throughout this school district. In fact, one could argue that an educator is a child development expert.
I agree with you. And I have several educators concerned.
And we listen to educators all the time. Educators are not of one mind about this. Is this the best for students? Is this an ideal situation from a learning standpoint? No, but it is the safest ideal situation for them. We do not solely derive our advice or information from DHEC. We derive it from epidemiologists and infectious disease experts. And you see right up there, proof in a small study, but I mean, I guess 38,000 is not all that small, conducted by MUSC, not by DHEC, not actually by one of the people we consult with, but MUSC. It substantiates what we're doing. And there's study after study after study of the limited studies that have been done that support what we're doing. Would this be our choice as best for young people absent a pandemic that's taken more than 400,000 US lives? No. But we believe it is the safest for our students and for our employees. And we hear from all sides. We hear from the side that you're hearing from. We hear from the side that they're very concerned about their child, their employees that are very concerned. We hear all sides of it. We've tried to focus our walk through this entire thing based on medicine and science and following the advice of infectious disease experts and epidemiologists. I understand your frustration and your concern with it. Again, I think we're all frustrated and concerned.
Has anybody done a study not using these protocols? I'm just curious, because I feel like that would be valuable. Is there a way we can request that of MUSC? For them to
Don't know where they would do it. I suppose we could certainly ask them. Most every district in this state, and when I asked the State Department this question, they said every district, but I'm going to hesitate on saying every district, follows in general terms the protocols we're following, some to greater or lesser degrees. So we're going to inquire as to the other places.
What about other states?
Well, the information that we've gotten from other states substantiates this same study. And we'll be glad to send you all those that we have. The place that we know, and I don't have the study right in front of me, I believe was not in the United States, was Sweden, Nancy, where they basically did nothing and had to completely shut down their schools. Now, that's not a U.S. study, but was in Sweden. We'll be glad to send you all that information we have. We have quite a bit of it, considering how recent that this situation has been.
Okay, so on that note, last question. Do you have any idea or do you have any thoughts? The next question I have is, and this is in line with what the district's already doing. You just sent out an email to everyone that said, hey, if you're interested in staying enrolled in virtual school, please let us know.
Right.
Parents are starting to, this is that time of year where they start looking at applying to, for example, private school options or charter school options, or in some cases that was in the fall, and of course, virtual school options. Mm-hmm. So I'm getting some questions. I'm actually talking to a school improvement council meeting tomorrow, and one of the questions that was sent to me ahead of time was simply asking from parents saying, hey, we want to stay with Greenville County as long as we feel like we are not going to be masked up behind plexiglass this fall coming up, 2021. So I know it's only January and you don't have the benefit of a crystal ball, but at the same time, are you reading any kind of tea leaves anywhere based on the vaccine rollout or what you're hearing, because you're obviously having conversations outside of these walls of what next school year might look like, because we've got parents who are seriously considering other options if this is the continued practice of the district. And I would just like to be able to speak to them on what they would like to hear something from leadership about that.
It would be our intent that next year is a return to normal. But when we get the kind of information that we've gotten about this vaccine, that certainly doesn't cause you to be optimistic, though we try to remain so. I think it's, as you indicated, it's way too early to tell, sitting in here not quite at the end of January, if that vaccine is ramped up, as they claim they're ramping up production. If that occurs, if this rollout is accelerated within our state, it seems reasonable to assume that February, March, April, May, June, July, that's 6 months, right? That in a half a year, we should not be in this same place.
Sorry, I said last question, but it kind of goes with it. Are we let's say teacher, the 1B crowd gets vaccinated as planned. So let's say by April, they're vaccinated both first and second dose. But the rest of the state is still waiting, or maybe, I mean, are we going to allow school to return? Or what is our expectation for allowing school to return? Is it just that the folks that work in the school district are vaccinated, we're ready to go, and but the rest of the community, it hasn't had an opportunity to vaccinate as they want? Or have you even thought that through? Does that make sense? Yeah.
Yeah. Based on my understanding, and we'd want to have more conversations with the people that, again, epidemiologists and infectious disease experts. The vaccine protects you, doesn't protect necessarily others from you unless they've had the vaccine. It protects you. So it would seem reasonable that if everybody we have that wants to be protected gets protected, it would certainly free up restrictions on employees. It would seem to me. Now, that's just thinking about it without having had the opportunity to have a full discussion, either with a group of other superintendents and these experts, or the ones we consult with locally about it, or with MUSC. We had some early on conversations with MUSC with Charleston, or early in the summer. I wish I knew some of the answers to the questions that you have. I'd like to have those answers myself. I'll try to choose to remain optimistic that we'll be back to a sense of normalcy by next fall. I hope that's not misplaced optimism.
I share it. Okay. Thank you.
Thank you.
Thank you, Madam Chairman. I know we're short on time, so I'll just keep it to 3 questions. The first one is, when we talk about Group 1B, and we talk about teachers and staff, do we have any guidance about what groups of employees that the Greenville County school system that includes?
Our understanding, as of right now, it would be all employees.
So any employee of the Greenville County School District is counted in that teacher group. So
that
food
is my
service,
understanding.
administration, district staff, everybody.
Yes. Now, in our discussions with them, we would, if they would accept prioritization, we would have some priorities within there. And based on people being frontline, for example, bus drivers, because of being in a confined space, every student passes by them. But I don't know that we're going to have the opportunity to prioritize within. They won't even talk about doing educators as a priority within all the prioritization, much less us prioritizing. But it's my understanding it would include all, Mr. Lewis.
Okay. And you mentioned the rollout, and I just, as a comment, would say that, I think Neil Collins, the representative from Pickens, has done a great job of kind of detailing out from a numbers perspective how long it will take us to get through each of those if we don't get more than 65,000 vaccines a day, which is currently the number that we're working on. And it is disturbing how long it will take to get to just the general population and outside of those numbers. So I share your concerns.
If I remember right, the last thing I saw from you, it sort of aligned with that March. Was that what you recall?
That's right. The other question I had is about athletics, and I know we've had emails about this. I just want to make sure that nothing has changed. So currently, are there any plans within the district to postpone or cancel any spring sports?
No plans to postpone. No plans to cancel. Now, Mr. Nance is having conversations, really most particularly with track, because of the large number that can potentially be involved in a track meet. You could have a multi-school track meet and have over 2,000 people on your campus. But that doesn't go to changing the season or competitions. They have made some changes. The ones I'm probably more familiar with have to do with track at the state level, like the qualifier, which used to be an upper state qualifier. It's my understanding now they're going to have regional qualifiers in order to break down the number of teams present in any location. Of course, that's not really our decision. That's a league decision. So there's some things that will look different, just like they have for every other sport. But I'm not aware of, now they have limited, the league has limited contest in all sports, but nothing beyond what the league's done.
Okay. And the South Carolina High School League, still the same thing. They have not given us any indication that they're looking at delaying spring sports.
Not delaying, no, sir. No, they have, and I couldn't tell you by sport, they have narrowed competitions, but they've done that statewide, so it applies to everybody.
Okay. The last question I have is, has the district revised its policy around visitors in the building, or what is our current policy around?
Right now,
visitors in
we
the
are
building?
not permitting visitors past the office lobby. We're still adhering to that policy.
Okay, so all non-district employees, including parents, PTA members.
Now, we have
FSC,
some volunteers that have been put on the payroll at some schools. In fact, I think you recall we talked about that, particularly with the middle school
Right.
returning. So we may have some of those,
Okay.
but not general volunteer operations. Now, we still have contractors obviously coming in, but they have to go through the same clearance our employees do.
The final question I have is just a request. If you don't mind, if you could just send out guidance about whether you would recommend board members to visit schools or not. Because some schools I've been invited to visit, some schools principals have said, we're not allowed to have you in the building. I want to make sure that that I understand kind of the guidance that you would recommend that we follow, knowing that it's by law our responsibility to visit these schools, but also being sensitive to the fact that parents can't visit these schools, but we are also kind of trying to do that. So if you could just provide us with some guidance on that, I would.
Certainly. And just in brief, we'd ask you to schedule that with the principal, but we'll make sure they understand that. Then, you all kind of have to make that decision about balancing visiting a school with, can parents come in or not? That certainly would be an individual decision you all would make.
I guess what I'm asking, and we can do it here or we can do it by email, but is it your recommendation that school board members not visit schools during this time?
Not necessarily, no, sir.
And so there's not a current policy that would prohibit school board members from visiting schools at this time?
No.
So if we go through a principal.
We go through the principal, schedule. Now, obviously, we would discourage more than one going because it just complicates keeping people distant, that sort of thing.
Okay.
Now, and we're working on some board tours. I believe you sent some in to Ms. Fitzer. And probably even on those, we will, unlike what we've done in the past, we'll probably split the group into smaller groups to go through the building.
Okay. Thank you.
Is that it, Mr. Lucy? Ms. Mosley?
One more question to piggyback off what Derek said about sports. My understanding, again, this is concerns that were brought on my radar today about track. Are the rules that are being discussed or whatever Mr. Nance's, the meetings that he's having, are they specific to Greenville County or are these set out by the South Carolina High School League? And by that, I mean, for example, track has never been a tryout sport. For example, at our schools, nobody has to be cut. If you want to go out for track, you can be out for track. And that's my understanding. And all of a sudden this year, they're limiting the number of people on the team. So this is upsetting to several parents. And then they've heard, again, parents are hearing rumors, so then they're making me aware of it. I'm just trying to clarify what is.
We haven't given any direction to limiting the number on a team. Now, what they might be doing is limiting on a team because of transportation. I don't know, but I haven't heard that. We need to know specifically where you're talking about so we can see why they made that decision if they did.
Okay.
One of the conversations that Mr. Nance is having with the athletic directors, and in turn, they with the track coaches, like some of these invitational meets, to limit who they invite, limit a school to, you can only enter 5 in this race or this field event, as opposed to in years past, but will you bring everybody? That has to do with being able to manage the group of people. But that doesn't have anything to do with the number being on a team. That's how many they feel like they can handle at a multi-school meet.
Okay. And I'm sorry, did you say that's something Mr. Nance is working to set up because of something the high school league has said?
That's just our ability or the school's ability to manage that many track athletes.
Okay.
You could literally have some, because East Side's really been a huge host of track meets. They could have 25 schools at a track meet and you could have 2,000 athletes over there. And in the best of times, it takes a lot of people to manage that.
Right.
So they have discussed if in these invitational meets, all right, you're going to need to send your 5 best,
Okay.
not the whole team.
Okay.
That's to the invitation to come in. That's just something they're discussing because of managing that size and that large number of students.
Okay. And then some parents were concerned, again, I'm not a track expert. They were hearing the rumor there was not going to be any Saturday events, which I guess might be these large events that you're referencing.
What they've talked about is
Scale them back.
how they might scale back those events to reduce the number of people there.
Okay.
Not saying you couldn't have one.
Okay. And the concern,
They tend to be the larger ones, you're right.
and the concern there is one parent in particular indicated that her son must be a star athlete. Scholarship, they're concerns because they apparently have her son had set up for colleges to come and observe or come and watch on those Saturdays, I guess. And to hear that they may not have Saturday events was upset or was concerning from are we going to miss out on scholarship opportunities that we might have
That
been?
wouldn't be accurate. And more directly to your point, if they are your high performing runners or jumpers or shot putters, or whatever they might be, they're obviously going to be the 4 or 5 you're going to enter into competition.
Okay. So just to
I would think that shouldn't be a concern. I mean, it's not, but it shouldn't be.
okay. So just to be sure, just make sure I'm hearing you say that you're not hearing the events may be scaled back, but not canceled or not.
Correct.
Okay. All right. Thank you. Yep.
I wish I had one question. With everything that's going on with what we're supposed to be doing with DHEC and the things, the rules and regulations that we're following and so forth, and then PRISMA, about the vaccines and where we fall, and St. Francis and all of these entities, how would we go about inviting them to see if they would come and speak to us? Now, I understand if they come here, then every district in the world is going to want the same thing. But for clarifications, a representative from the agencies, what is the best means of implementing or requesting this to these different agencies? And I didn't mean to get you wide. You took a big bite of that.
That's all right.
I just think there are a lot of questions, and
There are, and I think that they have in the past made very clear that they do not want to put an individual doctor in a public position of giving advice, that person is speaking for the entity. We would certainly ask them if that would be something they would consider, and whether or not they would do that, I don't know. Now, that would be very different from precedent that's been set by this board before, having outsiders come before the board.
yes, sir.
But regardless of that, I am not sure that's something they would be receptive to, but we can certainly ask them if they have any willingness to do so.
Well, I just think if we can ask, and if they decline, we've given it our best shot because we want clarity. And I think there are a lot of parents that would like clarity. They'd like to hear other than what they hear on TV. But that's something maybe we can maybe look at and see and proceed with the request. And maybe for the committee of the whole, or, as soon as we can. I appreciate your update, Dr. Royster. Thank you. Are there any other school board trustees that have any questions? Hearing none, we will adjourn from this update and take a 5-minute break before we go into